which I think is really a great achievement in medicine for patients in ulcerations. I had the great honor to be invited by Rahul Jindal to India this summer. And I was very surprised because in Germany, people have stockings, and the healthcare insurances which pay stockings and wrappings are very, very reluctant to pay the wrappings. But in India, the people are wearing the wrappings for the ulcerations, and they have flip-flops and then the wrap. And I think this is a real good advancement because you are able to make the same effect like I did with the bandaging, but doing it yourself. So I just would love to present this last version, and then we can discuss every other questions.
Excellent.
We have these wrapping systems which are self-applicable, more or less easy from one to other enterprise. You have a low cost, and if a German insurer would hear this, they would say, are you stupid? They are so expensive. Yes, but they have a long life. And I always, when I get rejected a wrap by a healthcare insurancer, I write down, you know, this bandage I showed you now, this bandage 6 times plus the nurse doing it is 1 wrap. 6 days wrapping. Bandaging is 1 wrap. And they write me back, you shouldn't prescribe the wrap, you should give them lifelong, I don't know, the bandaging. And when I write them back, listen, 6 days bandaging is 1 wrap. And then afterwards, you don't need to do a bandage anymore. Then immediately I get the okay and the go for the wrap. So it will take me months and hopefully not years to convince the healthcare insurances that they should just admit the payment of the wraps straight away. And here I copied this from the Sigvaris webpage. This is a little bit of advertisement. I'm sorry for that. I usually don't do advertisements for enterprises, and I show you 2 different things. One, this is the calf wrap, and this is the foot wrap. And the very, very interesting thing I learned in India is they have ulcerations on places I have never seen them. And I will show you where. We go back to the lady. I saw patients, normally the ulcerations of the venous ulcers, osteoporotic syndrome, are somewhere here. These people had their ulcerations here. But this is because they only used a calf wrap. I mean, 30 degrees and 98% of humidity is, yes, but if you only wear this, you start making the ulceration here. So it's very important to remind that these systems are not only until here where my ulceration is pending outside, but you should start at the article, at the forefoot with the wrap system. So my system, retarded scan, showing to how to done it. There is also a soft stocking below, which is no compression, which with you is warm money, yes, but it's cotton, it's washable. This one is really softer than the other one. You see that?
And if you want to apply even compression with the stocking, there are kind of sets coming with compression as well.
There are other sets with compression, you're saying, yes?
Yeah.
Okay.
So there are sets coming without compression and there are sets coming with compression.
Okay. But I think for the easiness of donning, it is without compression.
Yeah. Yeah.
Okay. Now, you see, this one is, and the camera, are you seeing like here? Yes. Like this part? Yes. Okay. The only one I know on the market that has this one, listen, you can move the foot without fixating this. And just because you have this part here, which is very soft, and you have a pre-fixation of the string of the wrap already in situ. You don't need more hands to fix it and then finish the wrapping. And I think this is the greatest idea ever because it helps you to donate to yourself. But now we have free time going. That's right. There are Velcro-based parts there, and you start like crossing them one to the other side. I mean, there are lots of them in the market, other ones like smaller, harder, you can measure the pressure and so on. But at the end of the day, the one measuring the pressure he is able to suffer is the patient himself. And there are TicoPress devices. These devices you can put on the skin to measure. Do you want to show something? First time, only two. The first time you put them without having any, without stretching. And you have these little, I don't know if you see them. You have this like little telephones look right on the skin. They like put it at the edge of the unstretched wrap. So just for the students like me, you put it like but just like this, and then you put this strap here, and you have an indication, this line, of the compression you would apply. Let me say, like this, you see this stripe here, and then if you want to make a harder compression, you go and make like this. And now you see that I have like covered the complete strap, and it is 46 millimeter HG. Is it too strong? She's very comfortable. So the wonderful thing with these straps is that you can like make it very strong, and people, again, 34, yes, people don't suffer. It's very interesting why with the compression stopping with the 34 to 46 millimeters HG, they would say, oh, this is horrible, I can't put it on my leg. But this is I mean, sorry, but I will name another thing. The first time in Bamberg in a meeting, I had of course a Sigvaris compression stopping class 2, 25 to 30 millimeters at the ankle, and maybe had their staircase system, and I just put it like I felt, and then measured it, and I added to the 25 millimeters HG on the ankle, I added 50 millimeters HG, and I felt like the king. So it is so interesting to see how you can modify and go higher with the pressure without having any negative feeling as the patient. But if you, for example, tell the patient you should go to 20, 23 to 32, this is called German compression therapy, we should adapt it like this. And then, of course, these other tools also. So to have a digressive compression. But the patient, I'm sure, will not do this every day. This is just the orientation for the first 1 or 2 times, and then he can adapt like that he feels. And then we have the foot, which I think is also a very good smooth material. Fitting, I tried this on a meeting, and I fit in my shoes. I had like sporting shoes. I would be able to fit inside my shoes with this one. Of course, slippers will not fit. And my recommendation would always be, especially if you have that ulceration, to use both. Better this one than none, of course, but use both because ulcerations are geared. And this slipper is so soft and so wonderful. You will panic if you have the lymph edema. You can also come until here. And another surprise, Sloan Rauscher has a lymphedema toe device. You can put around a wrapping around every toe, which makes it able to be adapted to every situation. But today we're talking about ulcers, and the ulcer care, this one is perfect because you need one. You don't have to be changing and brightening. It is much easier to be done than with compression stoppings. And how are they washed? Can you put in washing machine? Yes, you have to put them inside the net before the Velcro will destroy everything on its way. So important in the net that. And you can wash them in the washing machine. And how long is the half-life? How long are you selling this? How long do you tell the people they can use it? It is unlimited. Unlimited. It is not. It is soft, but soft.
Unfortunately, it's durable and it stays for long. I have seen patients using the same device for more than 2 years.
Yes, yes. So this is, of course, more expensive than buying a stocking, but for the long view, it is much more cost effective.
And it's actually not only one compression device, it's actually combined the 3 different compression levels. So if you want to adjust the compression up or down,
yes,
the patient can still use the same device.
Yes, yes.
Also the size and the
completely great.
measurement is having a wider size measurement, so it also covers wide range of
Mahmoud is being
size.
paid to say this.
You know. But you remember in Germany, I challenged Joseph Grace from Australia
Yes,
to apply it with one hand. And this is what we always talk about, the self-management, because during the COVID, we have learned a lot that we really need to make sure that we keep
Yes.
the independence of the patient to be able to do self-management at home.
yes.
With the CombaReflex, you have this part, which we call it the third hand, where the patient can use his 2 hands to apply the CombaReflex wraps.
And I tell you, I think the stocking, the smooth thing is wonderful, but the material is so soft to the skin that I, in summer, use it without. I didn't say this now officially, but I in summer used it when I go to meetings and stand all the day. I use this thing for my calf without any underneath layer because it is very soft to the skin. It's not itching or something.
Yeah.
Yes. So I think this demonstration you did very well. Thank you, patient, and thank you, Britta, for the for the demonstration. And this is what I wanted to show. Now questions open, discussion, of course.
Excellent demo again, and there is a lot of compliment from all the attendee with this new device and with how you apply it and the technique. And one of the questions that come to your mind, you can adjust the amount of pressure in the calf muscle different from the one just above the ankle. They don't have to be the same 30 or 40. So you can have like multi-modality situation of compression. Is that right?
Yes. Yes, and like I think Frandoni demonstrated, one Italian guy demonstrated that that you can put more compression on the calf than on the ankle also. This is especially good in sportive people because earlier we said the highest compression has to be the ankle and so on. And when they came up, these wrapping devices, you said, oh my God, how will you make sure that the ankle will be more pressure than... But it is completely the same. You can put higher pressure on the calf and less on the ankle. And at least the patient will notice when it is not feeling well, and he can just change the pressure. And sometimes it is not so good because they perhaps make it too loose. But even a low pressure is better than no pressure. So even if the patient goes and takes lots of pressure out, you can have an improvement. And coming back to the question before, bandaging the thigh. If somebody really needs a bandage of the thigh, I would always use this kind of devices. You have some for the knee and some for the thigh, and so you can apply them and adapt them as the edema goes back. So you have some situations, you have an acute thrombosis of the iliac vein, then you don't have to start with a wrap. You can bandage them because normally after 2 or 3 days you can go to stocking. But if you have a lymphedema for tumor patients, which is normally those that go to the thigh, the best thing you can do to the patient is really giving them something like this, because he, on his own choice, can put, when he goes to bed, he can unwrap it And this is quick. You don't have to call the nurse, wait for somebody making. You can have a shower and re-wrap you. And it is the only one that will stick to the thigh when you walk. Because the bandaging, you have to be really good. Coming back to India, I was invited to see a patient who self-bandaged himself, and he had 5 layers of short stretch bandages, one over the other, and this one managed to stick there. But I mean, it was like this thick, and in these situations, really the wrappings are the kings. I think they will be the future.
Yeah, excellent. Any question from my co-moderator, Dr. Mahmoud, Dr. Elena? Any question or comments or remarks?
I completely agree with you, Erica. In my clinical practice, wraps are constant, and for elderly people, I do think that they are the perfect alternative for those stockings that are impossible for donning and doffing. And for me, wraps are especially interesting when we have erosive pustular dermatosis due to continuous occlusion because of bandages. So it's a solution to have, when the patient is moving, we put the grafts, and when the patient is resting with elevated legs, we can leave the legs opener, obviously with topical corticosteroids, but this is the solution to avoid continuous occlusion with bandages for leg ulcers. So for us, it's a very interesting alternative. We use it daily.
Wonderful.
I think just one comment from my side, because as long as we are talking about the wraps, we have done a couple of studies on the wraps. One of them in Malaysia with a huge number of patients, and we got a huge, really impressive result that improved the healing from 6 months to 6 weeks. Dr. Hari Krishna, I can also share my screen just to make sure that you will also see that we have here in the MOH platform, there are different content about the venous leg ulcer, and we do different formats. So there is a one podcast here with the top-notch expert from the wound care community, and Professor Hari Krishna Nair from Malaysia did a huge big study there with I think the hospital having more than 5,000 beds or something, huge big hospital there, and they discussed all the results. You can watch here or listen to the podcast. We have also get some cases from Europe, also using the venous leg ulcer tools like the compression wraps from Austria, from Slovakia, from Greece, and all these cases actually using different devices and different things, but also seeing different patients. The good thing about the MOH platform here, you can just need to register to make sure that you receive all the newsletter, and you will see more than 100 of speakers from around the globe who are already part of the MOH, with also studies, documents, and different format as mentioned. So you will see here the essential, which is like small interviews with big leaders in the compressions, 10 minutes videos, specific questions related to the compression from Eva Drabe, from Giovanni Mosti. But also we have the Bulletin, which is a magazine every 6 months, twice a year, full studies, and also the Connect, plus the summaries. After each event, we write down presentation summary, so you can also read it if you don't like to hear or listen or see me in the videos. But it was really, really interesting, especially the study that we have done in the Combreflex with the venous leg ulcer. I think very, very interesting to see it. And if you want to have it as a hard copy, please reach out to our team. They will be more than happy to give it to you. But before we close, also, I would like to hear from all the experts here a take-home message after all these insightful discussions and the comments and the questions coming from the audience. Would be really great if we can get 1 minute from each one of you, just giving a take-home message to the audience to know more about that. By the way, I forgot to mention that we are for the first time live transmitting in different channels, like also the YouTube, but also here in our platform. or is it? I can just show it here. Maybe it's really important also to know that we were live here, as you can see. People can see for the first time live transmit. So we are trying also to make it easy for people. If you cannot register, you can just watch live on the YouTube or on the web page, but also on our LinkedIn page. So please follow, subscribe to the newsletters to make sure you are up to date. So now to the experts to give us a take-home message, starting from Dr. Erica Mendoza.
Thank you so much again for the occasion. Compression is important on the calf, always for the ulceration patients, and you should give them as much as possible and as little as needed to have the compliance going. And sometimes you have to start with a bandage and then adapt compression. Or if you have a situation that you can give the patient a wrap right away, I would always directly give a wrap because you can adapt the pressure. Thank you.
Thank you so much, Dr.
Dr. Erica, Dr. Elena.
The best dressing for a wound is the skin. Those wounds that are having a good evolution don't need cleansing or debridement. So once you grafted a wound, just try to space out dressing changes. Changing a bandage does not mean changing the dressing. You can put another bandage, leave the dressing in place if you have that direct and indirect signs of good evolution, and think about a physiological wound healing, not to impede wound healing if you have signs that it is having a good evolution. That's the less you can a wound that is having a good progression.
Yeah, okay. And thank you very much for the kind invitation, Dr. Mahmoud. I've learned 2 great techniques: how to apply compression, how to do punch graft to the skin. They are so valuable technique to treat a lot of chronic problem, to improve quality of life. And I did learn a lot from this webinar. I would like to thank everyone. And the mic is back to Dr. Mahmoud.
So at the end, thank you very much to everyone, to the speakers, but also to our audience and attendees. We got also so many questions in the live streaming. Unfortunately, they cannot be actively participating because they are not at the webinar, but we will send this question to you, Dr. Erica and Dr. Alina, and we'll get back to you with our answers. Special thanks also to Dr. Omar, my also co-moderator in most of the events. Really, really appreciate it. And I thoroughly enjoyed this event today. Learned also a lot as always. And before we close, again, I just would like to mention and remind everyone, please go to the Medical Online Hub platform. It's free, accessible. We have done more than 100 different activities since we started in 2020 with the COVID-19 and thrombosis event with Joseph Cabrini and big names. So you will find a lot of materials in different format. I'm sure also easy to navigate different indications. And we'll be happy to also receive any inquiries from your side or reach our team to know more about the products or the studies and the research have been done on this topic. So thanks so much, everyone. Hopefully we will meet again very soon. Please stay safe, stay healthy, and I'm looking forward to our next event. Thanks so much, everyone.
Bye-bye.
Bye-bye.
Bye.